So I was saying that we need to take care about what is the technology that we are injecting. And first thing, do we really know the difference between, for example, the NASHA technology that comes with Restylane and the old Perlane, and the new OBT technology, or the technology that comes in any other brand? So we're going to talk a little bit about this, because it really makes the difference when we inject these products in the skin of our patients. The first technology for HA, gels, cross-link that was described was the NASHA technology. This means non-animal stabilized, here you have it, HA. And what does this mean? This means that it maintains or preserves the natural molecular structure of the HA produced by the bacteria. Let me explain you this a little bit with an example. Can we go to the flip chart here? So, NASHA is like a tagliatelle. We all know tagliatelle. It comes in a box, and it's like a ball. So when we take that tagliatelle, it's hard. It's this kind of tagliatelle. It comes all mechanically cross-linked without having to add any synthetic BDD or cross-linker. We do have a mechanical cross-linking of the strands of HA. And that is the reason why this family, the NASHA technology, gives the higher lifting capacity that we can see in the market today. We will have two products basically in this line. They both have the same level of cross-linking, and they will add a few amount of BDDE and cross-linkers, because when you put tagliatelle into water, it becomes softer and it separates. So we need to add this small amount of BDDE to maintain all the HA together when we inject this product in the skin of our patients. Two products, they share the same level of cross-linking, but they have two different particle size. Small particle size, it's the classical Restylane. And with a bigger particle size, we will have Restylane Lift. This is known previously as Perlane. Okay, so this is a robust product. It gives a high lifting capacity. Can we go back to the presentation? So they're both 20 milligrams per milliliter in concentration. I remember in the old days when I didn't care about technology, when a new product was coming out to the market, they were saying, oh, this is a 28 milligrams per milliliter. It's really a fantastic product. But to be honest, you know, the lifting capacity is not related with the concentration. It's related with the cross-linking, and especially with this mechanical cross-linking. So here we have in summary, these are the two products. They're produced, you know, in a block, and they are cut with a very, very precise, you know, control particle size into two different particle sizes. The small one will be the Restylane one, and the bigger one, it's the new Restylane Lift. And this, as I told you, are the products that result in different lifting capacities. This is measured nowadays with what we call the G prime. It's a concept that it's a little bit, you know, more difficult to explain here in a little time. But, you know, the highest G prime of all the products now available in the market belong to this technology. And now we move to the new technology. It was called before Emervel range, and now we have it included into the Restylane range. This is the optimal balance technology. This is a range of products that are softer, and the reason is this one. Can we go back to the flip chart here? Zoom in. Yeah. So this is not tagliatelle. Now we have spaghetti. Spaghetti are a little bit more linear, although they're not completely linear. So we have a spaghetti here. It doesn't, you know, have this amount of mechanical cross-linking. So we need to add the BDD to make a cross-link product, a gel. And here we're going to combine 3 different particle size and 4 levels of cross-linking. And this is going to give us a range of products that will have different properties to be used in the skin of our patients to be able to personalize our treatment. Let's see which are the products that belong to particle size number 1, so the small particle size. We have small spaghetti. Level of cross-linking out of 4, let's say 1, it's going to be low. This is Restylane Finesse. This product, it's very good, small particle size, low cross-linking, when you want to inject fine lines, when you want to treat a mild nasolabial fall, and you need to inject the product quite superficial in the mid-dermis or superficial dermis. Easy to mold, nice product. Same particle size 1, so still small spaghetti. But level of cross-linking is 2. It's a little bit higher. This product is Restylane Refine. It was known as Classic. Okay, so this is a good product to be injected also in the deep dermis. If we have a deeper nasolabial fall, could be a product that could be injected in males, for example, in the forehead. Also marionette lines when they are not severe. Very nice product to be injected in deep dermis. Third product with a small particle size, small spaghetti. But level of cross-linking is 3, it's higher. So this product is Restylane Kiss. This is what I need. This is an excellent product in my experience. Why? Because I still have a small particle size. I want a natural result for the lip, but still highly cross-linked because I need aversion. So I maintain the natural result, of the treatment with a good aversion of the lip. Really, and also the duration, it's very, very acceptable, up to a year. Let's move into particle size 2. So now, particle size 2, we have a bigger spaghetti. And the level of cross-linking is 4. It's the highest. So it's going to be highly cross-linked. This product is Restylane Define. This is a fantastic product to give support or to lift. So if I have to treat a chin and there is not a severe hypoplastic bone, I might go for this product. Why should I volumize here? I need a product that will imitate a little bit more the bone structure, that will project more, but will not give volume. So this is highly cross-linked, but the particle size is intermediate. If I want a cheekbone and I have a young lady, for example, and she wants to improve because she's 38 or 32, and she comes to my clinic saying, I'm starting to notice a little bit of a saggy skin and I really want a treatment and they don't have a lot of volume loss, why should I go for a volumizer on the mid-face? I have a product that gives me a little bit of lifting, creates a little bit of a shape, and doesn't over-treat the cheekbone of that patient. That is Restylane Define. Finally, we have particle size 3, so it's the bigger spaghetti. But the level of cross-linking, it's not 4, it's 3. So it's highly cross-linked, but it's not the maximum level of cross-linking of this range. This is Restylane Volume. So, nice product for a softer transition to volumize because the particle size is bigger, but it doesn't have that high level of cross-linking so that it will not create an excess of shape or a contour. So this is the range. So combining these products, now I was treating any patient with the same product for years. And now I have a 52-year-old lady with a very thick skin, saggy skin here, a lot of nasolabial fall, but still have good cheekbone. Which product would I use? Thick skin, a lot of saggy skin. My priority is to lift. I would go for Restylane Lift. Do I have a young lady, as I said, that needs a little bit of lifting, not as much as this old lady, and doesn't have that much of saggy skin here? In the same area, I would go for Restylane Define, and I can have the same effect, natural effect, with this product. Do we have an older lady that has a lot of volume loss in the medial part of the cheek or cheekbone? Then I will go for Restylane Lift. So this is the time to start, evolving and personalizing our treatments, and we have now the technology that will help us to do that.